There are some people who have some narcissistic traits who actually do decide to sit down and talk to somebody. In this video, I want to explore some of this and some other ideas that I've come across as well. Depending on the level of narcissism that somebody is dealing with, because this does run on a spectrum, most narcs have that inability to self-reflect. Therefore, they don't see themselves or their behavior as an issue or a problem, and thus they seem to feel that no treatment for them is needed. But when narcs do find themselves talking to a professional, there are some pretty common reasons why, so I want to go over those. They're seeking help for a mental disorder. A lot of narcissists have other psychological issues. Many deal with depression and anxiety. I think we all pretty much do anymore. They might be feeling other issues from other disorders like bipolar or schizophrenia. I've read so many articles and heard people's stories over the years, and they talk about narcissists on medication for ADHD. Now, I'm no doctor, of course, I'll never claim to be one, but there does seem to be a trend with narcs and getting meds for ADHD. I don't know if there's any correlation or anything really more to that. However, it is a sign that some people with highly narcissistic traits and tendencies do talk to doctors about how they're feeling mentally. A narcissist might also seek out therapy for substance abuse issues. And substance abuse issues fall in line with mental disorders. A lot of people who drink or choose to do drugs or deal with anything else and it becomes an addiction, they're trying to mask and hide and run from trauma and real pain, as well as the mental issues that I talked about a moment ago. So in situations like that, they might go and seek a professional. They might go and talk to a therapist or get counseling for validation as well. Lots of narcs, as I'm sure we all know, love to play the victim. They aren't bad. It's all you. You're the cause of the downfalls and all the bad stuff happening to them, of course. So they will sit down with a professional, tell their side of the story. However, their side is full of lies, gaslighting, of course, taking no responsibility, playing the victim. And these stories that are told in the narcissist's reality, in their revisionist history of things. So when they project and make their partners out to be awful and highly narcissistic and abusive, they can sometimes be told by professionals, yes, they're in a relationship with an abuser. They should leave. This is unacceptable behavior. And now a narcissist will walk out of the office armed with this ego boost and a lot of validation and now proof, quote unquote, from a professional that you are the narcissist. You are the problem. You need to work on yourself because you see now they've gone to therapy and they don't seem to be the issue. So I found an article a few days ago. I don't want to name drop it, but it was a whole thing about treatment and therapy for narcissists. And the article immediately slammed non-professionals like myself for talking about narcissism because some people say that it can't be treated. They go on to add that these same dum-dums also call narcissists master manipulators who will fool a therapist and maybe only change briefly but revert back to normal. And it's usually for the sake of the narc's partner or what have you. And in the next sentence, they say that all of that is wrong and none of that is true. Narcissism can absolutely be treated. They're not master manipulators who attempt to fool anybody, and they don't just briefly change. That was the immediate next sentence. None of that is true. And I'm sorry, what? I'll talk about treatment here in a moment, but narcissists don't try to manipulate professionals. They don't sit down in therapy and act like they're making a change just to get their partner to be quiet. That's interesting because upon heading over to another site that I again will not name drop, they said highly narky people will often agree to therapy or counseling and then flip the script, play the victim, get nowhere quick, but it certainly shuts their partner up because they're agreeing to go to therapy. So I don't really understand all of that, but I do agree with the article when it says the internet has certainly become a place of misinformation when it comes to narcissism and narcissistic personality disorder. I also do, oddly, agree with the idea of a narcissist changing. The article says the same thing that I do. Anybody can change, but they have to want to. they have to not be afraid of change, not be afraid of doing things differently, and doing a little hard work, or a lot of hard work. And I believe this to be true. However, I think that some people have the strength and fearlessness to do that, and I think a lot of others, unfortunately, don't. But I hold this belief for people who don't even have highly narcissistic traits and tendencies. I think some people just have it, and some people, unfortunately, don't. If you'd like to get some counseling and coaching one-on-one with me and have a safe place to vent and share your story with the survivor, you can visit jess-stanley.square.site. The link's down in the description for you. You can see a list of my services there, as well as some other things. If you'd like, you can do all this through email. You can send one to bookachatwithjess@gmail.com. I can send you that exact same information that way. So there's 2 different ways for you to connect with me, and I look forward to hearing from you. The article also goes on to list some reasons why we don't hear about successful treatments of narcissistic personality disorder. And I just wouldn't be me if I didn't share these with you. So one of the first reasons that it lists is there isn't enough training for diagnosing and treating narcissistic personality disorder. The article blames psychotherapy training programs and that nobody basically becomes a specialist. They just become I'm not insulting anyone with a PhD, but they become a run-of-the-mill generalized person with a PhD, and they don't go into this as some kind of a specialist or a specialty. But forgive me for just being me here. Perhaps it's so hard to treat, not because we don't have enough specialists, but because this is the nature of the disorder. Actual signs of the disorder are a lack of self-reflection, which that's a lot of what you do in therapy. You're reflecting on yourself, taking responsibility, righting the wrongs, looking at the cracks in your foundation and where you can overall improve. This is what you do in therapy. A narcissist doesn't want to take responsibility. There's no wrongs to right because they don't do wrong. So you can't honestly try to tell me that there's not enough training and diagnosing for this, instead of saying maybe these are people who just don't want to do this or don't understand how to do this. It's like blaming the medical profession and not the people with the actual disorder. Not that we should blame them, but I mean, this is the nature of the disorder. It goes on to say the second reason why we don't hear about any success in this is learning to become a specialist in this is very costly and very time consuming. So apparently, as the true medical field shows, this is all about money. But I mean, hell, with people seemingly showing signs of this disorder just running rampant, you think people would pay for this magical training to cash in on some of the money. I would think it would be worth it. The article also goes on to say that you need 3 extra years of training to become really, really good and proficient at doing this. And again, maybe this is me just being really ignorant and uneducated, but I've never heard of this before. I'll never sit here and claim to be any kind of professional doctor. I'm a YouTuber. So who decides 3 years? Is that what it takes to become a specialist? I mean, who says? Lastly, it says that we don't hear about any successful treatment of narcissism because most narcissists avoid getting any kind of treatment, or if they do decide to go and get some kind of help, they leave too quickly before any progress is really made. And it says the narcissist might feel attacked by going to a place or, and talking to somebody, or uncomfortable, or maybe threatened. No shit, they avoid therapy, but wait a minute. You said no one is qualified to treat them. So are they avoiding therapy? Is there no one to treat them? There's no specialist, but yet they might leave because they feel attacked or uncomfortable. But wait a minute, there was no one for them to go to begin with. There might be a huge glaring point that I'm missing here, but I just really can't seem to make sense of what this article was trying to explain. And I'll just be fully transparent. There just might be something I'm taking the wrong way or that I misunderstand. That could be totally true. After all, they made it very clear in the opening that I'm just a non-professional dum-dum who says there's no treatment and spreads misinformation. So I guess what do I know? They do talk about stages of treatment that do need to be done with a narcissist to get them going in the right direction. So Maybe a program does exist, or maybe they're working on it or something, but I still have to speak from my heart. You can make 100 million people in this country alone, the US. You could make 100 million people specialists. Narcs don't get help because they don't want to. Change is hard. Change is scary. Narcissism also runs on a spectrum. Higher functioning narcs might want help, whereas other ones don't. There's too many variables to say all of them do or all of them don't. Coming to terms with not being perfect hurts their ego. I mean, we know how hard it is to get over our own ego bruises, and it's even harder for a narc. And I'm not ripping on them or anything. I'm just saying what it is. Here's why we don't hear success stories. There aren't any. There aren't any. And it's not because we don't have enough training. It's not because we can't see it. You don't see anyone that says, hey, I used to be a narc and now I'm not because I went to therapy and I figured all of this stuff out. Again, maybe there are people who claim to be narky and they go to therapy, but then they had lower levels of narcissism to begin with, and possibly another mental disorder that they sought treatment for. I think people need to come to terms with the fact that this is the nature of the disorder. And again, they can change, but they have to want to do it. And most of them just simply do not feel that way. I think some progress can probably be made with some folks, but it's so few and far between. And I'm sorry, this has nothing to do with people not being qualified. It's no secret on my channel that I talk about my own bipolar disorder. I don't and have never had a bipolar specialist. I went to therapy. I got real honest with myself about my mountain of flaws, which I still have, by the way. I've worked hard, I killed my ego, and I did what needed to be done with a counselor. The person that I worked with didn't even have a PhD, didn't need to have one. I didn't need a specialist. For a very serious mental disorder, I needed to grow up, get ready to change, become resilient, take responsibility, and I needed to get real. I had to want to change my life and stop being afraid to change my life. And I'm sorry, some people have that in them, and some people don't. Anyway, this article blew my mind. I had to talk about it. I just about don't know my ass from my elbow at this point. This thing was so mind-blowing. So share with me down in the comments what you think about narcissists going to therapy for treatment. Is there really a shortage of specialists? Is there hope? Can there be a change? Thank you so much for listening today. Please subscribe to help my channel keep growing. Have a great day, survivor, and take care of yourself.